Hi, I'm Dr. Yu. I'm a facial plastic surgeon here in Beverly Hills, and I'd like to discuss buccal fat removal or buccal fat reduction. And buccal fat is a fat pad that's discretely located in the cheeks. Everyone's facial volume is comprised of fat that's underneath the skin or subcutaneous fat and discrete fat pads, of which F.A.C.S fat pad or buccal fat is one. If patients have too much of a oval-shaped or rounded facial appearance and want to create a more tapered, more defined appearance to their cheek and lower face, then buccal fat removal or buccal fat reduction is a great procedure to achieve this. The procedure is performed through an incision that's located on the inside of the cheek where there's no scar that's visible, and that discrete fat pad is titrated and removed in a way that the volume will create a greater contour between the cheekbone and the cheek itself. And so that there becomes, instead of one single unit, definition in between the cheekbone and the cheek. The procedure can be performed under local anesthesia or asleep under general anesthesia and will leave stitches that are absorbable inside the mouth. Those stitches generally dissolve over 1 to 2 weeks, and once they're gone, will leave no visible scar. The contour that's caused by the buccal fat will taper because the volume will be removed, and between 3 to 5 cc's is a typical volume that's removed from each side during the procedure. You can see that for some patients, the change can be dramatic, and it creates a much more defined and contoured appearance to the cheekbones and the face itself after recovery. Buccal fat removal is a great adjunct to other procedures as well. For this beautiful patient, she chose to create greater definition and augmentation of her nose in addition to creating a more tapered cheek and jawline appearance. And so for her, we performed open rhinoplasty with rib cartilage and fascia to augment the dorsum or bridge of her nose, as well as create a more feminine, sloped, prettier, delicate profile and frontal appearance. And you can see in the after how she has greater definition through the bridge of her nose, and also the tip has a lot less volume and comes to a smaller, prettier point. In addition to reshaping the bridge and tip of her nose, we also addressed her ala or the nostrils by adding alar rim grafts to create less flare and a straighter, more elongated, defined appearance to her nostrils, as well as alar base reduction to reduce the width overall of her nostrils. This created greater balance and a prettier U-nose.
I went from pretty to prettier thanks to Dr. W.